I'm going to talk tonight about something that I'm very passionate about, and something that affects all of us, because all of us have kids or have grandchildren or are involved in the local community with the youth that we have, and we don't want to see them get injured. And this is really part of a national campaign to help raise awareness about some of the overuse and traumatic injuries we're seeing in our kids and what we can do to hopefully understand it better and prevent these injuries. The problem is really there's 30 million kids that participate in organized sports. So that's a huge number, and it's great that they're active and that they're doing these things. And what we see is that participation in high school athletics is actually increasing, with more than 7.3 million high school students participating annually. But the things that most people don't know is that high school athletics account for more than 2 million injuries annually, and there's over 500,000 doctor's visits and 30,000 hospitalizations. So it's a real burden on our healthcare system and on those families that have to take care of these kids. The other thing we see is, as I mentioned, are young athletes are specializing in sports and positions at earlier ages, with more than 3.5 million children under the age of 14 treated annually for sports injuries. And overuse injuries, which are defined as injuries that they're just doing the same thing over and over again, account for half of all the sports injuries in middle and high school. So those are definitely preventable. Any type of overuse situation is somewhere that we can intervene. And the main causes really are that we have immature bones, we have insufficient rest, which I'll talk about over and over again. Poor training and conditioning are all contributing factors. We also see that children ages 5 to 14 account for nearly 40% of all the sports-related injuries that are treated at hospitals. So of all sports-related injuries, 40% of them are occurring in our young people. So we have to figure out why is that and what can we do. And these kids are not, maybe they don't have the same information that an adult has about taking risks and the same decision-making capability. And one thing to consider is that the rate and severity of injury increases with a child's age. And another important point is that while 62% of all the injuries occur during practice, so only about a third of the injuries are occurring during games or competitions, 2/3 are occurring during practice. Only 1/3 of the parents and coaches have kids take the same safety precautions during practice that they would during games. So that's a perfect opportunity for us to intervene. They should have the same safety requirements for practice that they do for competitions, so that we prevent some of these injuries. 20% of children ages 8 to 12 and 45% of those ages 13 to 14 will have arm pain during a single youth baseball season, which is a huge amount of kids that are getting injured. Injuries associated with participation in sports account for 21% of all the traumatic brain injuries among children in the USA. So a lot of the concussions and traumatic brain injuries we're seeing are occurring in sports. And according to the CDC, more than half of all sports injuries in children are preventable. Injuries during a single season among athletes age 5 to 14. So 28% of football players on a team at this age are going to get hurt. 25% of baseball players, 22% of soccer players, 15% of basketball players, and 12% of softball players. And I would say that skiing probably ranks right up there with football, or maybe even higher. Since 2000, there's been a 5-fold increase in the number of serious shoulder and elbow injuries among youth baseball and softball players. And you might ask, well, why is that? Well, the three things are: one, they're playing year-round, they're specializing early, and the final one is the radar gun. They're throwing for speed. They want to throw as hard as they can, and their skeletons aren't prepared to absorb those kind of loads. So there's an emphasis on how fast, how hard do you throw, and that's created this big increase in shoulder and elbow injuries in baseball players. So the problem with this is that if a kid has an injury, it's a risk factor for future injury during both their youth and their adulthood. And I had a patient in the office last week who said, I'm experiencing all the injuries I had when I was a kid again. They're all coming back to me as aches and pains and all the different joints that they injured as a kid. So there's some truth to that. The injury doesn't go away completely. There's lasting effects that occur. And it's also, in more severe cases, it's a contributor to long-term degenerative diseases such as osteoarthritis, problems with the knee, problems with the shoulder, problems with the elbow. So we want to try and prevent those and avoid them. The second thing is that many of the kids that we see who are young will drop out. And then they have the problems of obesity, becoming couch potatoes, diabetes, all that. And the reason, you want to keep kids active, you want to keep them active in a safe way. And really the top three reasons, according to the CDC, is adults, coaches, and parents. Too much pressure on them to perform and not enough keeping it just for fun. And these children will lose the benefits of exercise, teamwork, and really healthy competition. And those are really the lifelong lessons that we hope to teach our kids from participating in youth sports.